Continuing Mobile Education for Emergency Medical Services Providers. This is Episode 4 of Evaluating the Older Adult Physical Exam Pearls. At the end of this episode, you should be able to describe common physical findings associated with aging and describe some of the acute physical findings seen in the older adult.
Well, as part of normal aging, there are a few things that you can expect to see in terms of physical findings. One thing that we see as old people age is that response time tends to be a bit slower. So that during the interaction in a physical exam, often we find that older adults will respond a bit slower than younger counterparts. This is outside of the context of there being neurological impairment or dementia, but just as part of normal aging. We need to account for that in our interactions. One of the other changes that we see is changes in muscle bulk, so that as people age, it's considered a normal part of aging that muscle bulk slowly decreases as people age. We also find that muscle strength similarly decreases with aging. This is true even among healthy and active older adults. The other common change that we'll see as people age is changes in skin. So that in the older adult, you'll see a thinner quality to the skin that's a bit more fragile than that of younger adults. The skin also has a decreased elasticity, so that it doesn't have the tensile strength that younger adult skin might. This puts older adults at increased risk for things like bruises and skin tears, even when they're healthy.
Some physical findings that occur with natural aging include increase in patient response time, decrease in muscle bulk and strength, and skin thinning and decreased elasticity.
Two ways to sort out whether the exam findings are a normal part of aging or whether they're an acute process is primarily to ask the patient, ask the family members, or ask a staff member at the facility whether this is a change in baseline. That can be one of your biggest keys to deciding whether this is normal for that patient or whether this is an acute change. The other is to examine the patient. If you have a concern about bruising, whether there's a potential fracture or other injury underlying, if it's not bothering the patient, a good rule of thumb is it's probably not acute, although that is not always the case.
To help differentiate new versus old findings, ask the patient's family and other caregivers if this is a new finding, and ask the patient if they are bothered by the finding.
One of the most important things for examining the older adult, in my opinion, is observing them. I think simply by watching the older adult and how they move through their environment, one can gain tremendous information about that individual's health status and function. So seeing how they walk in their environment can tell you a lot about their balance. It can tell you about their fall risk. Seeing how they communicate with others can tell you about their level of consciousness, can tell you about their clarity of thought. These things can be tremendously valuable in putting together the package of how that older adult is doing. I think as a geriatrician, we think a lot about function. And the way that you best find out a person's function is to watch.
There are numerous physical exam findings in older adults that are cause for concern, and the possibilities are endless, so I'll just name a few. One that goes along with strokes is tearing in one eye. Now, if a patient just got something in their eye, or they have some kind of infection in their eye, that's a special case, but a stroke can present with patients tearing in just one eye. Some other physical exam findings are fever or rigor, which could indicate some kind of infection. And fever is especially useful in allowing us to help differentiate between different kinds of respiratory causes. Another physical exam finding that's important is sudden weight gain, because sudden weight gain could indicate that a patient's a high cause are likely to go into florid pulmonary edema. Another physical exam finding that's significant in elderly patients is unilateral wheezes. We often hear wheezes, but unilateral wheezes could indicate a foreign object in the lungs, could indicate some kind of tumor, or it could indicate some kind of pneumonia. So it's important that I think we take good lung sounds on both sides and in all lobes.
Some of the commonly overlooked physical signs in the pre-hospital arena include arm drift, which is a component of the Cincinnati Stroke Scale. It's something that needs to be actively looked for and can't just be seen just by looking at the patient. Also, evidence of bruising. If the patient doesn't get a complete physical exam, looking over their back, their sides, their torso, their proximal extremities, they might be covered by clothing and the frequent bruising could be missed.
Some often overlooked findings include arm drift, which is part of the Cincinnati Stroke Scale, and bruising, which can be indicative of abuse, falls, and other issues that need evaluation.
I just have two caveats that I could think of for a physical exam in the older adult. One is be gentle. Their skin tears easily, they bruise easily, they're fragile. So be gentle with elderly patients when doing physical exam. The other one is always remember to check a blood glucose level. Even if a patient's blood glucose is like 180 or 200, it might not be a cause for immediate concern, but keep in mind that their blood is more likely to agglutinate, is going to be thicker and therefore more likely to clot.
When it comes to physical findings in the older adult, one of the things that I think it's important for EMS providers to be aware and observant for are changes that might suggest that an older adult was at risk for elder abuse. And so the things that EMS providers might look for are signs that that individual has been abandoned. So does their home suggest that they've been left unsafely? Does the comment of that individual suggest that they feel like they don't have the necessary support system in place? From a physical perspective, are there bruises, particularly bruises on the insides of the arms, of both arms, on the insides of the thighs, might raise a red flag for the possibility of abuse of the older adult. Fractures that are healing at varied states might also suggest elder abuse. Elder abuse is one of the things that as a society we probably could do a better job of being aware of and intervening upon. And I think EMS providers are well suited to identify situations where this might be occurring and raise that red flag so that people can be evaluated. The other things on physical exam that might suggest elder abuse are things that suggest poor care. So burns, perhaps difficulty with urine burns, things that suggest poor continence management, skin breakdown over sites of pressure. All of these things might raise red flags in the EMS provider that they could then communicate with primary care providers or emergency medical providers to investigate a bit further to ensure that older adults are properly cared for.
Those of us in EMS are in a unique situation to be going into the environment in which these elderly people live. And so frequently we might be the best person to make a recommendation about getting social services involved or suggesting to family or other healthcare providers some recommendations about whether they're in the appropriate place for their situation. I remember one call I went to where an elderly man was sitting in a chair and he was having trouble breathing. Well, he was also hypothermic and had severe pneumonia, and his O2 sat was down in the 50s. He was in very bad shape. He was in a room full of garbage and on a floor that had no carpet. When we got him into the ambulance and we had done everything we could to help his breathing, we were bringing him to the hospital, I noticed that he had a lot of sores on his torso and underneath his armpits. And when we got to the hospital, the physician there said that those sores or asked us if he had been sitting up in a chair, and he thought those sores had been caused by the family tying a rope around him to hold him up in the chair so that he didn't fall out of it. And so his opinion was that that patient had been living in the chair upright for he didn't know how long, but those sores didn't develop overnight. And so for that patient, a social services recommendation was made, as well as a report regarding elder abuse. And so I think elder abuse is something we also ought to consider frequently when we're going into the environments in which these people are coming from.
Signs of elder abuse and neglect include your general impression. Does the patient look abandoned? Suspicious bruising, history of multiple fractures, and potentially poor personal care. After finishing this episode, you should be able to describe some of the common physical findings associated with aging, and be able to describe some of the acute physical findings seen in the older adult.